Today, I am here to speak to you all about a topic that affects a lot of families, which is eczema in children. Before we start on that, let me talk to you a little bit about what I do and what I've done so far. So, homeopathy is something that I was born into, as maybe a lot of you might already know. I was born into a family where my father was a very prominent homeopath, Dr. Farokh Master. He had been taking us to the clinic ever since we were small, and so homeopathy is something I've kind of been born and brought up with. Homeopathy is an alternative medicine that originated from Germany more than 200 years ago. And being one of the more natural methods of practicing medicine, it's a great alternative for children. And so I decided to do my specialization in pediatrics. Another reason being that when I used to be attending my father's clinics through my undergraduate training, I always used to see mothers carrying these big files for 4-year-old kids, 5-year-old kids, going from one doctor to the other, one prescription after the other, constantly suppressing their child's complaints. And at the end of it, having really no results to show for it. And so allergies was something that really prominently came up with that. Unfortunately, allopathic system of medicine does not have the correct treatment protocols for allergies. All they can do is to some extent suppress it, but there's really no treatment and cure which is available for it. Whereas luckily for us with homeopathy and allergies being a very, very common complaint with small children, homeopathy is able to really turn the child around and eliminate the allergies more from the root. So there's really no suppressing of the symptoms, but the child actually learns to cope with that allergen and does not show the kind of symptoms that they normally would. Uh, Eczema, again, is a very predominant allergy. I am also now working in Singapore, where I have been living most of the time now. And so just to give you an idea of the numbers that we see, almost 1 in every 5 child has eczema in Singapore, out of which 50% of them go on to have eczema for their entire life. So those are quite staggering numbers, and it's actually very sad to see children having to live with it, because eczema is something that hampers your day-to-day functioning. You see children covered head to toe with eczema, constantly scratching, itching, can't sleep, can't eat, can't focus in school, lack concentration, grades go down, develop infections on their skin. So it's very sad to see children in such a state. And unfortunately, the most common mode of treatment given is steroids. So steroidal applications is something which is very commonly used. It completely suppresses the eruptions. Everyone's happy for a little bit until after a few months, the eruptions start coming again. You have to apply the steroids again. And then eventually it comes to a point where they stop working and the body just lashes out and the eruptions completely take over. So at that state, a lot of mothers then realize, that we probably need some form of alternatives. So what does homeopathy do for children with eczema? We deal with eczema cases in a very constitutional manner, so to say. So let me talk a little bit about eczema first, actually. So eczema is, as I mentioned repeatedly, it's an allergic manifestation. The body responds dramatically, so to say, to any form of allergen. The allergen could be in your food. It could be something that's around you. It could be environmental. It could be something as minor as the detergent that is being used to wash the child's clothes. It could be in their shampoos, in their soaps. It could be in the material of the bed sheets that you're using. It could be 1 million things, and it's absolutely impossible to narrow it down and decide exactly what is it that is the allergen triggering your child's eczema. And so I guess testing is one option, but again, not very conclusive, not very definitive. Sometimes it does pick up the major allergens, which would be your egg allergies, could be your nut allergies, very commonly seen as your milk and your dairy allergy. And so sometimes eliminating these allergies does give you some form of relief, but not always. And so that's why it's very important to get to the root cause, which is trying to manage the body and the cells that manifest this allergy. So we basically have to teach the body in simple language that this is not something that's life threatening. You don't need to react the way you are reacting at this point of time, and to calm down the allergic or the immune manifestation to that allergen. So that's where homeopathy comes in, because our medicines act deep enough to be able to regulate that mechanism. What we do with homeopathy is we understand a child from head to toe, the allergic manifestations for sure, the eczema symptoms for sure, but along with that, we also understand the nature of the child, the eating habits of the child, the sleeping habits of the child, any other complaints that they may have. And homeopathy, being an individualistic and a very precise form of medicine, has a particular individualistic remedy then selected for that child, which will act on the child's entire being and not simply at the level of the superficial level of the skin. And that's very important. Now, I see children with eczema coming all the way from 2 months of age, 3 months of age to teenagers. And the allergic manifestation completely depends. When I see kids who have not been suppressed with steroids, of course, the response with homeopathy is that much better and that much faster, because the body is not immunocompromised. Whereas in a person who's come with repeated applications of the steroid creams and the antihistamine treatments, we definitely see that it does take them a little longer to respond and work with homeopathy. Um, my advice to mothers who have children with eczema would be to not explore just the treatments that give you quick and instant relief, because while those of course give you instant satisfaction, your child is better, the itching is better, you are happy, the doctor is happy, everything is well and good within a couple of days, almost 99% of the times that allergy either gets suppressed and comes back as an eczema a few months later, or it comes back as another allergic manifestation, because still you don't really treat the body from the inside until that allergen keeps disturbing that child's body. It will then show up a few months later as maybe asthma. It can then show up as an allergic gut issue. So all of these things can start coming up if you do not treat the child with a more deeper remedy. And so that's why my advice to them would always be to explore other options, explore more gentler options. When it comes to children, our entire aim is to build on them and give them the strongest possible foundation. We don't want to weaken them right from the time that they're 2, 3, 4, because as we now already know, immunity plays such an important role as they're going to go ahead, grow older. We want to try and build that foundation as strong as possible so that it is not shaken by the future health concerns that this child may have. Another thing that probably I think is worth discussing on is the gut issue related with eczema. So what we have noticed now in this generation of children is that they are almost walking around with 80% of the gut bacteria that are probably last 2-3 generations were walking around with. What this means to say is that they're functioning at a 20% capacity of the good microbiome that they are supposed to have. This little fact is enough to disrupt the body's entire immune system. One of the reasons why this is happening now is also because of the way that we are delivering kids. We've completely gone from being as part of nature as possible to being as mechanical, as scientific, as machine related as possible. And all of this is something that has completely disrupted children from being a part of nature, from being able to sync their entire body with their surroundings, to us functioning in a very dysbiotic way. And so that's again something which is very important, which is a very important cause for us children having immune manifestations, allergic manifestations. Children now have obesity. Children now have increased risk of Crohn's disease, of allergic asthmatic diseases, of eczema. And we did not see all of this probably 2-3 decades ago. And so again, this boils down to the fact that we need to improve our microbiome. One of the best ways to do that is to have a good, healthy diet, to have as much of fiber in your diet, have as many pre and probiotics possible in your diet. And all of this comes from good nutrition and good food. So children with eczema or children with any complaints, or even for that matter healthy children, diet would be one of the most important things that a parent should be paying attention to. Sugar is your child's worst enemy, so definitely make sure that your child's diet involves as little, especially of the processed sugar, as possible. I am not against any of the natural forms of sugar, but processed food, processed sugar, your child's number one enemy. Just stopping that itself when your child gets eczema will show you a lot of positive results. uh, Again, fiber, as I mentioned, a good source of protein, making sure that your child is having different colored foods and vegetables, meat to a certain extent, as long as it's raised in a particular manner that is cage free, and you're making sure that the meat is not raised with antibiotics and steroids. Good eggs, cage free eggs, a good source of meat, not farmed, good source of fish, not your farmed fish. All of that is very important when you're trying to decide the best way to incorporate nutrients with your child. Um, and I'm open to any questions now. So yes, please. Uh, any questions that the parents may have? Okay, so someone asked, will the allergy test help my eczema? Okay, so as I mentioned earlier, allergy tests, while they do have a small role to play in this, they don't ever form the complete picture. So, for example, I have had numerous patients who have come to me, a lot of mothers who will tell me that my child has come out with in the allergy test with an allergy to this, this, and this. But I have noticed that my child is not allergic to it, because every time I have given it, my child has really had no bad reaction. But at the same time, when I give my child, for example, let's say um, okra or ladyfinger, every time I notice that when I give my child something like that, the child tends to flare up, and the test was not able to pick that up. So the tests aren't very reliable. While they do form a broad idea of, okay, this and this and this can be eliminated, we normally see, as I said, the basic allergens coming up. So your egg allergy, nut allergy, milk allergy, your gluten allergy, all that predominantly are the ones that tend to come up, but they're not true for every single child. Again, what happens with the allergy test is a lot of mothers focus only on the allergy test and think that, okay, we'll eliminate this from the child's diet and the child will be okay. But it's not a very practical solution, because it's very hard for a mother of a 4-year-old child who's going to school, who's going to birthday parties, who's going to go out with you for movies and restaurants, to avoid things which the allergy test has come up with. For example, we don't realize, because when we can eat everything, that the minute one ingredient is taken out, a lot of the things go away. And so when you have to stop that 4-year-old child from having things that he really enjoys, becomes really tedious for the parents. And so again, I feel like only removing the allergens is never the solution. The body still needs to be fixed, because allergens change. For example, I have 15-year-olds who come to me and tell me that suddenly we have developed a milk intolerance. We never had it while we were growing up. We were completely fine. Now, every time that I have milk, I suddenly realize that my skin is red, is itchy, it's inflamed, or I start developing coryza, rhinitis. And so again, these allergies, which were never existent, can just come up one fine day. Why? Because your body has been compromised with their immunity. And so fixing the immunity has to be your number one priority when you're dealing with any condition. Okay, so we go to the next question. Wanted to know what is the very helpful session. Wanted to know what is the eczema look the same, how it is for adults. So eczema can present itself as different ways. I have had children coming to me with eczema with vesicles. So vesicles are these little pus-filled boils that you see all over the body. Sometimes eczema comes as complete dryness. There are different types of eczemas, and so they are the diagnosis is based also on the presentation. So sometimes we see atopic eczema, which is complete dryness of the skin, where there's scaling. Generally, eczema presents with a lot of itching. So itching will 99.9% be there in almost all the cases of eczema. You do see redness, you see inflammation, and what they have to be very careful of is that you should not develop a superseded infection over the lesions which have eczema, because sometimes when the skin is raw, the layer of the skin is very thin, your chances of getting infections always increase. Does homeopathy medicine help for eczema? Yes, definitely. In fact, I feel like we're luckily one of the main branches of alternative medicine that have excellent results when it comes to eczema. As I said, the main purpose of the homeopathic treatment would be to go in and fix what's wrong. We want to fix the body's response to the allergen. We want to make sure that the body is not overreacting. So basically, the immune system is in a hyper state. So it's a hyper functioning immune system. We want to tone that down. We want to tone the allergic responses down. And we want to teach the body that this is not the response that is required for that situation, which is where homeopathy comes in. It acts beautifully. In a few months, I have seen children which are covered head to toe with eczema getting completely cleared. As I mentioned, the younger you are, the sooner you come in, the better the results. The less suppressed your condition is, the better the results. So it definitely does help. There is unfortunately no one medicine I can tell you that works for eczema. As I said, homeopathy is so individualistic and so precise that I have to know every single detail about you before I can decide what medicine is it that works the best for your child's eczema. We do have certain remedies that we use along with that, which we call home remedies, which are your grandmother's old traditional remedies that basically help with controlling the itching or the burning or the discomfort that they feel. And so I'll probably share a few of the common ones we'll end up using. One of them is oatmeal. Oatmeal works beautifully with eczema patients. It completely manages to subside the inflammation and control the itching. So if you have the luxury of having a tub or a bath where you can actually lay down with a tub filled with water mixed with probably 2 or 3 tablespoons of oatmeal, that would be excellent. But if you don't have that option, what I do recommend to patients is to take a muslin cloth, fill it entire potly with some oatmeal inside, dip it in water, so soak that oatmeal for a little bit, and then put that over the lesions that let's say if the elbow has the lesions, then you put it over the lesions that has the eczema, and it tends to really help with the itching and the inflammation. Also, oatmeal baths, oatmeal scrubs, oatmeal soaps, very, very good for managing any kind of eczema. Aloe vera works very well. Refrigerated aloe vera works even better. So just a cold aloe vera application over the eruptions when they're inflamed and itching, instant relief, works much faster and much better than most of the creams available that are medicated. Coconut oil again works very, very well. Some children do have a coconut allergy as well, so it's important to know if you have that. If you don't have that, wonderful. Coconut oil works very, very well for your skin. It keeps it hydrated. It acts as an antibacterial, antiviral, antifungal, so keeps your skin protected from any kind of superseded infection, and overall tends to moisturize the skin. So these are some of the home remedies that we also recommend along with homeopathy, as they both act simultaneously. I mean, it's trying to use nature as much as possible to be able to help us heal. The whole idea is never to give a medicine and fix the problem, but the whole idea is always to give you some homeopathy so your body can learn to fix its own problems, because our body is so ever intelligent and has been we were created from 2 invisible cells, and this is the body that was created from that. So don't for 1 second think that your body does not know how to heal, does not know how to work, can only cause diseases. No, it knows how to heal. It's a matter of triggering it in the right way. It's a matter of stimulating it in the right way, so your body knows exactly what to do and eliminate that eczema by itself without any other aid. So if there are any other questions. Okay, perfect. So there's no other questions. Y'all can always follow me on my Instagram handle, which is at the THE Immunity Doctor. That's THEIMMU NITYDOCTOR. And my details are otherwise on my website, www.drrukshinmaster.com. Also, you can find me on Baby Chakra. And if there are any other questions, feel free to reach out. Okay, see you.